Welcome on stage. I'm
Thank
super
you.
excited for having you here today to talk about this very important topic, antibiotic resistance, right?
Yes.
It's not a topic that we are hearing so much or that doesn't have so much attention yet. I hope in the future we'll have. But I would like to ask you, what do you do exactly in ResistomUp and what it is when we talk about antibiotic resistance?
Yes. So at Resistomap, we fight this antibiotic resistant bacteria that resistant to antibiotics. So this is not human that are resistant to antibiotics, but the bacteria that infected us become more resistant, so antibiotic treatment failed. So to mitigate spread of this resistant bacteria, we empower governments, pharmaceutical companies, hospitals, and food producers to identify the hotspot of this resistant bacteria in the environment. Because together, we need to protect not only human and animal health, but also environmental health as a one health concept.
Great. It's actually, thank you for framing the misconception.
Yeah.
Because mostly you go to a hospital, you go and you're like, oh, you should not take antibiotics because you develop a resistance to that. But it's not actually the human body that develops a resistance to that. It's that the bacteria is getting resistant.
Yes.
And what implication does that have in our health and our environment?
Yeah, so the problem is that, indeed, thank you, like to clarify it, because there's a lot of misconception that, oh, I become resistant to antibiotics, where we are always resistant to antibiotics, because antibiotics develop to kill the bacteria that infected us. So the relationship is to the environment is because antibiotics are consumed by us, resistant bacteria develop in our gut system, including in the animal. I need to mention also antibiotic use a lot in animals. So when animals and humans consume resistant antibiotics, resistant bacteria develop and release to our waste, which is then spread to the environment, either both from the wastewater in the hospital, in the communal, or especially in pharmaceutical manufacturers. In agriculture, is through the manure application in the soil, and of course then through food chain system. So that's why it's very important to understand or to address antimicrobial resistant, antibiotic resistant as a one health concept.
What are the main issues from the climate change perspective that actually affect antibiotic resistance?
Oh yeah, it's really, really highly correlated because climate change makes the temperature hotter. Hotter temperature, bacteria grow faster. So the spread of this resistant bacteria in the environment in the warm temperature will be like unstoppable, and it's not good for us, right? If these resistant bacteria are everywhere and infected us, because for example, if you go swimming, if this resistant bacteria pollution are increasing, then the chance for you to be infected not only when you got sick in the hospital, but it's simply just you go swimming, or if you simply just eating food from the street food like grilling, that is not nice. So this is why the hotter temperature through the climate change highly associated with this resistant bacteria spread, and it's important for us to stop together. Like the spread of this resistant bacteria before it's too late.
How we could stop that?
Wow, very hard indeed. Then that's why I think first of all, we are here. We work together because it requires multi-sectoral collaboration. It's not only us, let's say, in the laboratory or scientists. It just didn't work if it's just only in research. We need to communicate this to the community, to the government, to the industry, and work together. First, from the water sector, we can improve the wastewater treatment. Especially, as you may know, unfortunately, 80% in the world, wastewater treatment are not well implemented. So this is important of the sanitation in the world to be improved. And then in the food sector, there's important to tighten the regulation on the use of antibiotics. And of course, on the limit, the pollution also from the food production and the antibiotic manufacturers and the pharmaceutical companies. So we need to work together to fight this issue, because this is indeed is not just one action. It requires more like a collaboration together to mitigate the problem. And that's why, as I mentioned, the one health concept.
Yeah, that was about to ask in the moment that we are not, and the thing also highlighted when we started, that it's not only that we have to do something for ourselves, like, oh, I take care about what I eat, I'm trying to choose, to live in a country that is more has more better treated facilities regarding sanitation. I wash my vegetables or whatever, but it's not like that.
No.
Everything that we do wherever around the world, it actually affects that.
Exactly.
So if we don't take action, at the way that the animals are treated, the way that the water is treated, the way that the temperature is rising and what it's causing actually affects the whole circle. And you mentioned also the academia part, the scientific community. So would you like to tell us a little bit more and guide us through how did you start working on that topic as well?
Yes. Okay, yeah, I think indeed like it's starting from 13 years ago, 2010, when I moved to Finland. So at that time, I moved to Finland from Indonesia, like from Java Island in Indonesia, in the middle, like tropical country, moved to this Nordic. But I moved there because I want to study my PhD at the Department of Microbiology at the University of Helsinki. And that's where I learned about this antibiotic resistance. And actually, I learned it's not only a problem for the doctors in the hospitals, but also for the fish farmers and for the environmental pollution. So my PhD was to investigate the source of this resistant bacteria in the fish farm and how the impact of fish farming to Baltic Sea environment. So I just realized, whoa, the antibiotic resistance is a bigger problem. And that's why I start, after my PhD, I did my postdoctoral research that I want to bring this research to my home country in Indonesia. So in Indonesia, I studied more about this pollution in the water system. So I study the antibiotic resistance from the spring water, like in the nature, and then follow the stream of the river when there's an impact from the rural animal farms, from the chicken slaughterhouse, from the hospital, and of course from the communal city up to the estuary in Indian Ocean. And I found that in the nature, in the spring water, there are bacteria, of course, right, in the nature, but that resistant bacteria are not detected, were not detected. So in the nature, in the water ecosystem, this resistant bacteria should not be there. But that just 1 kilometer, when there's the impact of this just rural animal farm, I think the farmers only has 20 cows. They don't have, 1,000 cows or anything. But out of 400 markers that we monitor, over 200 type of resistant bacteria were detected. And then going down to the chicken slaughterhouse, over 300 different markers even found more detected. And then going to the hospital, not more resistant found, but the abundance are increasing. And then the community, because there is no communal wastewater treatment, or at least the people living near to the river, they just release everything to the river, then the resistance increased significantly. This is the reason that actually the level of resistance almost as high as the swine farms in China. So that's horrible, right? But you couldn't see them because there are bacterial pollution. You think that it's just water. But then this is the problem. Then I just realized, wow, this is a big problem, but not so many people aware of this issue because you don't monitor and you don't maybe have the capacity to monitor this. So this is one of the reasons that I moved from academia to build the company ResistomapModerated 5 years ago after my postdoc. Then because I feel like the need that people should have the access to this technology, right? Not just in high-income countries to be able to do this, but everyone in the world should have the access to this technology and the knowledge that I have the privilege, of course, study in Finland. And then that's why I built this ResistomapModerated. I make sure that everyone in this case, government, including private sector, of course, not only researcher, to monitor, to have the capacity to monitor this resistant bacteria so that they understand the problem and they can make an action. Right? That's what we want, like
exactly.
How to mitigate them.
How to make informed decisions, right?
Exactly.
Because you see now the water, maybe we have it as a very nice background over here on the table as a visual that it looks clean, but you don't know if it's actually clean.
I hope the drinking water are clean,
but we haven't touched it yet, so we will not try it now. I don't want to. But especially when we talk about spring waters, that we have associated spring waters with clean, water that it comes from nature and this is sacred, which it is, but we tend to forget how we have contaminated the whole natural circles, the whole system, and how this has an effect. The way that, as you said, like slaughterhouse, our own waste, all of them dump into a river, and when it actually end up. And so my question on that is to clarify a little bit, what do you do with ResistomapModerated? You said that you have the technology, but then what is the process that you offer so that we have access to this data and we know how polluted is the water or not?
Yes. So, for example, that as I mentioned again, like so when the government, government need to monitor, right, the level of this resistance to understand the pollution in their regions. So if they don't have the capacity lab to do that, they can just sample to us, and then we can analyze the data and we deliver the result to them in the dashboard. And this information, so that can give them a better understanding the level of resistance. Maybe I would give an example. Like, for example, we work with the one city municipality in Finland called Uusikaupunki. It's like new city. And they request our service to monitor the 15 point of the bathing water surrounding the Baltic Sea, because they are worried if the water quality are not good enough for the citizen to swim there, because few years back, they just released the wastewater from the hospital directly to the sea. So they just consider like, uh-oh. And then we support them by monitoring the 15 point water sampling, like, because of course to see the quality of water. And then we deliver the result. So I told them, you are fine, the level of resistance low, so it seems like the nature are healing. I think because in Finland, 8 months are frozen. But we don't know in the warmer country. I don't think that is not the same as in Finland. But the idea here that we identify from the 15 point sources, there's 2 point actually still releasing this kind of the source of resistant bacteria. So now the government there, they use the data to identify where this source is coming from. Is it really coming from the communal, or is it from the farm? And this is why we kind of communicate this data to the government, and the government can share this to their citizens, so that you guys are free to swim now, because we monitor, we have the data, and it's a publicly can be accessed. So our data, we can provide the information for the public, but also can be secured, because there are some certain information, for example, in the private sector, maybe they're not ready yet. It's not for the public consumption, but it can be for them just to, you know, fix their farming system, for example, and on the hospital management, for example. So those, we also make sure that their data are authorized. I think it's very important, right, also on helping the different stakeholders to work on mitigate this issue in different kind of service. And this is also to mention that in Resistomap, we can customize our let's say our service to help them to fix the problem, and then understanding what action they can do based on different stakeholders.
So the first the first action I would say that is that governments are coming with the initiative to see what is happening in their area. Basically, are we polluted or we're not? You do the data and then the data analysis, and also identifying where does this pollution comes from. It's like, do we have a problem in hospitals, waste treatment facilities? Do we have a problem in some other sector, let's say, that dumps or like puts the flows of the water in this specific area? But then there is the point of action.
Yes.
What is happening in the point of action in terms of releasing this type of contamination, but also preventing this type of contamination from the scientific perspective?
Yes, I think maybe first the wastewater treatment, right? I think this is the first thing, go back to the wastewater treatment. For example, if the wastewater treatment in the municipal are not yet optimized in removing this resistant bacteria, we could help them by identify the point source. For example, a municipal usually also have many hospital wastewater need to treat. So we can identify which hospital that are releasing or discharging more resistant. And then we can have the in-situ wastewater treatment in this pinpoint. Or it can be maybe there's a slaughterhouse or like maybe food producer in the city. So that we can, with our data monitoring, we can have like targeted intervention where this intervention should be put first. So that we can save the resource, right? And money is very important too, especially with talking to the government, right? We need to make sure where the money should be put. And this is very important that we can support the government to identify where is the real problem should be fixed, like this way, but for the action. This is one way, but there's another way of like how we can mitigate, but this action, It's very different again on different sector and different stakeholders, and this is why we always like recommend them first to understand what is the problem. Monitoring first, pre-screening, identify, characterize, and monitor the problem first, and then we can have a better interventions. Not just like, oh, let's do intervention all. And then we don't even have like actually the problem was in different places.
Yeah, but we fixed it now, right? So I think it's very much related with the whole panel discussion that we had.
Exactly.
We don't need any more quick fixes. That we
Exactly.
have a problem and let's cover it and problem solved. Let's see the next 4 years in the elections what will happen.
Exactly.
But to identify and put the resources in a systematic way that address the problem and manage to eliminate. I want to like create a picture of a pessimistic maybe scenario. What will happen, if you can give us some hints, what will happen if we don't address this issue about
biotic resistance? Oh my God, I was like, no, don't even have that thought.
That.
Yeah, but I think the worst scenario if we don't do anything will be like we will go back to the era in the Middle Age before antibiotics. Yeah, I don't think everyone want to go back to that era, right? Where the hospital, especially if you work in the medical sector, so like no, because it means there will not be surgery, organ transplant, which is already daily hospital service, right? It is very normal medical activities. But without antibiotics, those activities will be fatal. Or even when you deliver the baby, it can be like the high mortality will be high. And it's not good, right? Because, I mean, you don't want that happen to us, and especially in this case, children or the elderly, where they're very vulnerable. If they get infection, resistant bacteria, then it's very easy for them to, you know, like there's no medicine work with them. Sometimes for the young, we can still maybe some immune system, like, but then unfortunately with the resistant bacteria, immune system also will not help. That's the problem. So means that this resistant bacteria issue, it affects everyone, rich, poor, young, health, children, especially if you have a problem with the immunocompromised and all of this cancer, disease, and this kind of thing. Even the healthy people like us get food contamination, you know, like simply diarrhea. It could kill us again. That is really bad situation, or at least I don't want to live in that kind of a world. And this is one of the reasons I try my best, like to work together with all of us, trying to communicate. And thank you for ChangeNOW to give me this opportunity to inform people the importance of this antibiotic-resistant issue, that it is really big problem.
It is indeed a really big problem, and as you said, it travels us back in time when we had the problem that science doesn't have the necessary tools to actually address this problem. And now we have reached a point that science has developed so many different antibiotics to prevent us, but we have extremely used it in ways that we shouldn't have, maybe.
Exactly.
In a way that they're actually useless for us now. But do we have this capacity to develop? One way, maybe, and I want to discuss that, is do we have the capacity to develop more antibiotics and continue in that way without solving the main issue, or do we have another way to do that?
It is indeed, like currently there's two ways that we are addressing this problem. One, indeed, try to develop finding the new antibiotics, or even maybe not even antibiotics, you know, like phage therapy or gene therapy or any kind of technology that can replace antibiotics. So there are this one direction where the investment are put to fight this AMR, and another way is like what we do now, try to protect what we have now until this is ready. Because unfortunately, the first way, like finding new antibiotics, is really hard, because when the investment to find this new antibiotic is really expensive, and then when we found the new compound, we need to pass through the clinical tests, and it takes at least 5-10 years. When it's ready to be used as a medicine, in 3 months or even in 1 month, bacteria will develop resistance. So this is why, for pharmaceutical company, the investment is useless. So there is no communication with the government, like how to incentive pharmaceutical company to still develop the new antibiotics. On the other hand, the new, let's say the new technology to replace antibiotics, it's really great, but then unfortunately it will be only targeting privileged community. because new technology usually will take many years to be applied in every part of the world. So in the other part of the world, they will still need antibiotics. And this is why the second way that what we do in ResistomUp want to make sure everyone in this world like to have the, the access still to antibiotics as long as we can.
As a final note, what is one thing that we can change now as communities, as individuals, to actually fight against antibiotic resistance?
As an individual, of course, like awareness, this is already one thing, but because with the awareness means that I hope that every of us know when the doctor prescribes antibiotics, we need to make sure, is it really needed, the prescribe, and understanding, do we really need to take these antibiotics? And then the second one, I hope that us as if an individual work together as a community to request, for example, simply your water company. You're paying water every month, right? And usually in this water fee that you pay is included the water treatment. The fee to treat your wastewater. So make sure that you understand the wastewater in your regions are treated well. And you have the right to ask the water utility, hey, how is my wastewater treated? Because usually you forgot after flushing, right? So we need to be more aware also the important how the wastewater are treated. And then the third one, of course, talk to the government. I think in the last discussion also, right? We need to give the voice to the government, making sure the use and regulation of antibiotics and the waste treatment in every sector, hospital, food industry, and antibiotic manufacturers are treated well. So keep the pollution lid low. I think that everyone agree all about the pollution, right?
Thank you very much. And I think now we have all one mission to do after ChangeNOW conference to actually ask how is our water treated in our places, in our communities, in our facilities.
Please.
Thank you very much, Windi. It was a pleasure to have you here today.
Thank you. Thank you, everyone.